Hello, viewers of Instagram. Dr. Randall Hayworth here, talking to you today about revision facelifts, and I do see a lot of them. The type of revision facelifts I am not referring to are those ones that perhaps were performed 10, 15, 20 years ago, and they have just worn out. Remember, plastic surgery reverses time, but time still marches on. I'm talking about the patient who may have had a facelift 1 to 4 to 5 years prior, who come to me complaining of something they were dissatisfied with the facelift. Maybe because it was not tight enough, or that the neck was never addressed and the patient expected the neck to be dealt with at the time of the initial facelift. In other words, the bands may still persist like these, or the patient may have a turkey neck with a lot of fat that still remains under the platysma muscle. So as a plastic surgeon, the first thing I'm going to do is examine the patient, and I'll look for scars. Now, these facelifts fall in the traditional category. It doesn't matter whether they're compound facelifts, deep plane facelifts, high SMAS, low SMAS, Y SMAS, doesn't matter. They're all going to involve an incision in front of and within and around and behind the ear. The incision in front of and within the ear reflects a redraping of the face skin, while the incision behind the ear reflects a redraping of the neck skin. And there was a trend going on, propagated by some of the thought leaders in the field of plastic surgery, saying that, hey, we can address the neck just through the incisions behind the ear and redrape it this way and avoid an incision in the submental region right here entirely, and you get a good neck. Well, it turns out that that's not the case, at least in my opinion, because the common theme with these patients that are dissatisfied with their neck after having had a facelift a few years earlier is the fact that they do not have an incision under their submentum or under their chin, indicating that nothing was done there. The purpose of an incision under the chin is to afford the surgeon access to the anterior neck structures. In other words, to define the anterior borders of the platysma band here and sew them together like a Victorian corset or shoelace, and take out any fat underneath said muscle. And that, in my opinion, is the best way to get a trampoline tight as a drum neck. And then, of course, we complete it with the incision behind the ears, redraping the skin and also tighten the muscles back there. And that, viewers, is how to deal with the neck in a revision facelift. There are no shortcuts in life. Remember that. And remember also, believe what you personally see and not what you watch, except what you watch here. Thank you for watching. Have a great day and stay safe.